Hi, I'm Tanmoy Mitra, editor of ET Edge Insights, and today I am in conversation with Dr. Elias Sharma. Dr. Sharma dons a lot of hats. He is the head of neurology in Jammu Medical College. He's a professor and he is also involved in a lot of other things. I'll just ask Dr. Sharma to just introduce himself. Dr. Sharma, first of all, welcome to ET Edge Insights interview. And it would be great if you can let our audience know about, what are the other associations you are associated with.
First of all, thank you, Tanmay, for giving me this wonderful opportunity to spread the message. So, more importantly than heading the Department of Urology, I am Nodal Officer SOTO.
Right.
That is State Organ and Tissue Transplant Organization. It's a central organization being set up under National Organ Transplant Program, NOTP. And government has planned to have one SOTO in each state. And we have 5 regional organizations which is called ROTO, and for North we have that situated in PGI Chandigarh. And the apex body is in NOTO, that is situated in Safdarjung Hospital. So
Right.
these are all central organizations. The main aim of these organizations is to give impetus to the diseased organ donation, that is the cadaveric organ donation, to promote cadaveric organ donation in our country. I just want to share that we are such a populous country, but if you compare us with countries like Spain, they are way ahead in cadaveric organ donation, just because there is lack of awareness and all those things. So these organizations' main function is to spread the message that after a person becomes brain dead, his organs are still living.
Right.
If you can maintain his organs, if you can maintain his heart beating by putting him on ventilator and giving some drugs, we can retrieve the healthy organs from that brain dead person, because you can never, bring him back to life.
Right, right.
So those precious organs, which are creation of God, each person who can donate these organs can save 8 lives. People who are in need of organs, for example, who is having cardiac failure, he can be given heart. Who is having lung failure, he can be given lungs. Similarly, kidneys can be donated, liver can be donated in case of liver failure, intestines, pancreas. These are just the organs, and then there are other tissues also. Eyes, like cornea, can be donated. So when one is living, he can pledge his organs for this noble cause by approaching our organization like SOTO, ROTO, and NOTO. If you just go on Google, you will get all the details, the address, and everything. So that is our main activity, to spread awareness and organize this disease organ donation in India.
That's fantastic. But Dr. Sharma, that brings to a very interesting question. You talked about awareness. Now, in our country, especially when we talk about organ donation, there are a lot of myths about organ donation and apprehensions. So people are actually reluctant to pledge their organs. So if you can just give a clarity on that entire thing, then probably, that awareness level increases among people.
Absolutely, Tanmay, that is a wonderful question you have asked. Now, the main myths, which are there in people who, who approach us, first of all, they will say, if I pledge my organs, and unfortunately, if I meet with an accident and I am admitted in a hospital and they see my donor card, the doctors will not treat me.
Right.
They'll just let me become brain dead so that they can retrieve the organs and give it to someone.
Right.
So, first of all, I want to clear that, see, the retrieving teams, the transplant teams are totally separate.
Right.
And the teams who treat the patient when they come to the emergency or ICU are totally separate.
Yes.
So there is no interconnection. Only after the maximum effort has gone into saving the life of that person is, once you realize that after having put all the efforts to save the life, nothing is working, the brain death is already there, then the brain death committee is formed. There are 4 doctors, qualified doctors, including neurosurgeons, neurologists, internists. So they come and they perform certain tests, and then they declare the patient brain dead.
Right.
That is one test. Okay, and you have to repeat that test at a gap of 6 hours. Only after that, 2 tests becomes positive that the patient is brain dead, is he declared brain dead. Before that, you cannot. and then the transplant team is involved. They don't come into the picture before. So that is one myth.
Right.
The second myth is, if I have a pledge card, they will just take my organs without asking anybody. No. If you are still, even if you have pledged your organ when you are alive, and unfortunately somebody meets, brain death, till his first of the kin or attendants give permission to retrieve the organs, you cannot take the organs.
Oh,
Legally,
all right.
you cannot take.
Yes.
So you have to have their signatures. There is a proper documentation. There is signature. There is proper form is there which you have to fill. Then only we can retrieve organs.
Right.
Third is, a lot of religions, they say that in our religion this donation is not allowed. That is very untrue. And I have gone through every religion, and in every religion there is no contraindication to donating our organs. So every religion, in fact, says that you should help in promoting life. So that is one message. And then there is a myth that am I too old to give organs? No.
Right.
There is nothing like your chronological age. It is your biological age. How healthy your organs are. If your organs are healthy at the age of 80 years, you are fit to donate. And then sometimes one feels that if I pledge my organs and they take the organs, they might sell my organs to a person who is rich. It never happens like that. Actually, when there is a brain death, the parameters of that patient are collected, they are given to SOTO, and they are transmitted to the national body. It comes onto the waiting list. So that there are waiting lists proper, and the organs are matched, and depending on the waiting list and the matching, it is allotted. It is totally impartial.
Right.
So first it will go to the one organ will go to the hospital where it is being retrieved. If there is an extra one, it will be put on the waiting list, and whoever according to the waiting list or the tissue matching takes place. Tissue matching, whether there is a matching of the tissues between recipient and donor, it will be supplied.
Right.
And there is no money involved in this.
Yeah. So Dr. Sharma, we see that with SOTO in place, this cadaver and organ donation is certainly something that our country people are being made aware of. How do you see the future, and do you see that more and more Indians coming forward and actually pledging their organs? So what is your assessment of this?
The good news is it has been happening a lot in some of the states. I must appreciate that, like in Gujarat, in Maharashtra, southern states like Tamil Nadu and Karnataka. These are states, they are setting examples for others to follow. They have made their organizations so strong. People are really working for that. And they have been able to do a lot of work on cadaveric organ donation. And our mission is to, bring it in north side also, where we are still having.
Right. One final question, your message to the audience, and if you can say something on what people should do or think about organ donation.
Two messages, one in Hindi is that Jeete Jeete Raktadaan, Jate Jate Angdaan.
Very well said.
And then the other message would be, these organs are creations of God, and don't let this precious organ get buried or get burned after your death. So just donate them to save lives. That would be my message.
On that note, Dr. Sharma, thank you for your time and your insightful information on cadaver donation. I'm sure there'll be a lot of learnings from your conversation for our audiences. Thank you very much for your time. Thank you. Thank you.